Hello there. Welcome, everyone. My name is Tracy Mullen-Kosker, and I am the Director of Customer Success with Aquifer. I'm really excited to be with you today to talk a little bit more about our new courses, tools, and other features that have been added for this year's subscription. As we get started, I'd like to just kind of overview the agenda. So our agenda today is going to be a brief introduction, as we're doing right now, of who's going to be presenting on our panel today and some of the information that you can expect to hear from each of those individuals. We're going to talk a lot about the new tools and cases. That's going to include Calibrate, our new formative assessment, the new neurology cases that have been added to our subscription, the clinical excellence case sets, and our expanded integrated illness scripts. Then we're going to talk a little bit more about making the most of your subscription, how you can understand and leverage the various tools and assets that we have available to implement the Aquifer system across your entire medical educational curriculum. And we're going to wrap it up with a Q&A session where you can get answers from some of our esteemed panelists who are employees at Aquifer and are also relationship managers. Some logistics before we get started as well, especially in regards to our Q&A, to make sure that that goes off as well as can be expected. We encourage you to use both the chat feature to post any questions that you may have, as well as our Q&A panel. So there is a Q&A panel that you can also add your questions to. We will do our best to monitor the chat throughout the conversation and throughout the presentation. Anything that we aren't able to address either live in the QA session at the end or via the chat feature during the continuation of the webinar, we will be sure to follow up with you at the end when we send out our recorded version of this webinar. So our panelists for today, to give you some brief introductions, include Dr. Emily Stewart, who is our Chief Curriculum Officer, Amos Esty, who is the Managing Editor at Aquifer, Leah Romano, who is a Relationship Manager, as well as Kate Hancock, who is also a Relationship Manager here at Aquifer. So without further ado, I'm going to go ahead and turn this over to Dr. Emily Stewart, who is going to kick things off for us today.
Thank you for joining us today as we discuss what's new with Aquifer. My name is Emily Stewart, and I'm the Chief Curriculum Officer. Additionally, I'm an adult hospitalist and Associate Program Director for the Internal Medicine Residency Training Program at Geisel School of Medicine at Dartmouth. Before we dive into the new courses, tools, and resources, I want to give a brief overview of Aquifer for those who may be new subscribers. Aquifer is a unique nonprofit organization dedicated to advancing health professions education through use of high-impact virtual teaching and learning methods. Just in case we have brand new users joining us today, I want to highlight that our curriculum created by the consortium is developed in collaboration with our national educator associations like ComCEP for PEDS, as an example. Aquifer cases cover the medical student curriculum established by these national organizations. Additionally, these same Aquifer cases map to the curricular guidelines for both PA and NP schools. This ensures broad, comprehensive coverage of key conditions and patients. Aquifer was created by educators for educators. All Aquifer's content is developed and maintained by a remarkable interdisciplinary team of educators working to ensure our cases and learning tools are accurate, evidence-based, and up-to-date. And our network is growing. More educators are joining this collaborative team, including the areas of PA and NP education. Now, before we get started with the new courses, tools, and resources, it's important to know if your program is a curricular partner or limited subscriber. Curricular partners have access to all Aquifer content and resources, including all of the new material we are going to talk about today. More than half of our subscribers are currently curricular partners, so there's a good chance that you may be as well. If you're not sure, you can use the QR code that will link you to a list of our 2022-2023 curricular partners. If you aren't a curricular partner, have no fear. We'll talk about how programs with limited subscriptions can access their content as well. Did you know your subscription includes access for all learners at your program? Programs use Aquifer to support their preclinical and didactic phase learners. flipped classrooms and TBL sessions, core and elective clinical courses. You can combine content from across our courses to support your unique needs. Aquifer is continually improving and is building a next-generation learning system to support our curriculum more broadly. What does this entail? A comprehensive clinical curriculum that serves tomorrow's clinicians through data-driven systems and efficient learning utilizing formative assessment. Now let's dive into that formative assessment system. One of the tools we are most excited about here at Aquifer is our new formative assessment tool, Aquifer Calibrate. I'd like to take you through a high-level overview of Calibrate and show how implementing it can help to create master adaptive learners. I'm going to start with a brief overview of the reasoning and pedagogy behind it. Calibrate is assessment for learning. Moving beyond traditional summative assessment of learning, test-enhanced learning is a pedagogical approach in which students are continuously assessed and reassessed as a formative process. Test-enhanced learning helps students identify weaker content areas in need of further study, as well as areas of relative strength on which to build further, allowing for more focused and efficient study methods. Test-enhanced learning has been shown to improve overall student study behaviors and aid in metacognition, helping to create that master adaptive learner we all want in our students. Aquifer Calibrate intentionally connects learning and assessment with meaningful feedback, supports effective coaching, and provides clear direction for advancement, all driven by smart data. Importantly, the system must work equally well for both our educators and our learners, providing realistic processes and tools that can be implemented in today's clinical learning environment. Calibrate assessments are multiple choice assessments with a certainty rating for each question. They're short, with 25 to 45 questions per exam, approximately an hour long. They're designed to be given 2 times during a clerkship. They're easy to administer with no proctoring required, and they're available at no additional charge with family medicine, internal medicine, pediatrics, and radiology subscriptions. With all of this in mind, let's look at a sample question. As you can see, Calibrate questions include a typical board-style clinical vignette and multiple choice question, all developed, peer-reviewed, and validated by our expert educators in the Aquifer Educator Consortium. A key feature that makes Calibrate different is the certainty rating for each question. The certainty rating adds a new dimension to assessment results, taking feedback beyond simple right and wrong answers to provide a more accurate view of gaps in the student's knowledge. Embedded within the system and reporting, our new metric, the clinical learning calibration, provides students with a more granular and useful tool to assess their current knowledge base and applied understanding. The new dimensions of certainty and efficiency, which serves as a proxy for the ability to recall and make a clinical decision in real time, in addition to accuracy, provides students and faculty deeper data for understanding cognitive competence. The Calibrate system is designed to identify the gap between perceived and actual competence. This, we know, is the most dangerous gap for all of our patients, and it is critical that we help our learners identify and address it. These new dimensions of data linked to our curricular mapping converge in detailed reports for students that link directly to teaching points in Aquifer cases. Faculty and programs receive high-level views of student performance and detailed views of cohort performance for curricular planning. With their complete learning picture identified, students are now armed with the information they need to create targeted study plans. Calibrate's detailed results help students take the next step, providing what they need not just to find the answer, but to understand the clinical context and to leverage this information throughout their patient care experiences. For faculty and administrators, Calibrate provides the tools needed for students to create an individualized study plan, preparing them for meaningful feedback and coaching conversations. And importantly, these processes further support accreditation standards for mid-clerkship feedback. So in summary, in developing Calibrate, we addressed many of these challenges for you by providing a high-quality, nationally developed formative assessment system designed for clinical learning. We are currently piloting Calibrate for a variety of medical schools, PA, and MP programs. You can learn more about Aquifer Calibrate on aquifer.org. I'd now like to turn it over to my colleague, Amos Esty, the managing editor of Aquifer.
Hi, everyone. I'm Amos Esty, the managing editor at Aquifer. I work closely with the clinicians who create and update our content, and I'm excited to talk to you all about the new content that will be available to subscribers this year. So we have a lot of new and updated content going live in July, including a new neurology course, new and updated cases in our clinical excellence case sets, integrations that bring important clinical and basic science threads into our signature courses, and several new integrated illness scripts. So I'll start by talking about our new signature course in neurology. Neurology, of course, is a key topic in all health professions education, and Aquifer is really excited to expand our curriculum to include this course and better serve our programs, faculty, and learners. The course will provide coverage of the clerkship guidelines endorsed by the American Academy of Neurology. The development of the course was led by a task force of neurologist educators, including the two lead editors of the cases, Doris Kung, an associate professor of neurology at Baylor College of Medicine, and Alexandra Hoviguimian, an assistant professor of neurology at Harvard Medical School. The cases are being written and peer-reviewed by neurologists from academic medical centers around the US. Aquifer Neurology will provide concise, focused cases that will be a perfect starting point for facilitated group learning sessions. The 15 cases in Aquifer Neurology include 8 entirely new cases, 5 cases that are being adapted from existing Aquifer cases in our family medicine, internal medicine, and pediatrics courses, and 2 cases that will be shared from our existing Aquifer radiology course. As with our other signature cases, the cases in Aquifer Neurology will follow a clinical encounter with interactions between a student, a preceptor, and a patient. Each case will include a brief integration with our basic science or clinical excellence curriculum, which I'll talk more about in a minute. They will also include self-assessment questions that ask students to apply knowledge from the case to brief patient vignettes. The case content will serve to better equip learners with the knowledge, skills, and attitudes needed to provide patient-centered care to their communities. Now I want to talk a little bit about Aquifer Clinical Excellence case sets. These case sets include both updates to existing cases and some new content as well. First, here's a list of the courses we currently offer. We have the courses focused on core clerkships and key electives for medical students, family medicine, geriatrics, internal medicine, pediatrics, and radiology, and courses such as diagnostic excellence, high-value care, and social determinants of health that are relevant to all students, but aren't necessarily covered in any specific rotation. We are expanding our coverage of these topics by grouping them into clinical excellence case sets. So we will have 2 types of clinical content. Our signature courses, which generally cover more discrete clinical areas, including the new neurology course, and the clinical excellence content, which is intended to introduce students to these really important topics that can sometimes be overlooked. Each clinical excellence case set will begin with a principles module that covers the core principles relevant to that topic. After completing the principles module, students will gain access to a series of short, patient-focused application cases. These cases are perfect for integrating into preclinical and didactic phase courses, adding to a core rotation, or for building an elective. In addition to these clinical excellence case sets, which will provide extensive coverage of these important topics, Aquifer is also introducing just-in-time integrations of clinical excellence and basic science content into our signature courses to help ensure that this key content is reinforced throughout a student's core clinical rotations. What this means is that cases in the signature courses will have a page of new content that's tied either to one of the clinical excellence case sets or to Aquifer's basic science curriculum, providing just-in-time learning for students and allowing programs to ensure these key topics are covered without requiring more faculty time. Here's an example taken from case 29 in the Aquifer Pediatrics course. In this case, the editors on the pediatrics course board decided that a palliative care integration would work well as part of a section in the case that deals with delivering serious news to patients and families. There's a multiple choice question that asks students to think about the topic, and then an answer comment that includes a teaching point taken from the palliative care course. So students will have the opportunity to learn some of the principles of palliative care within this pediatrics case, integrating the teaching into an existing patient scenario. The benefits of taking this approach to integrating the content are that students will be able to learn and apply clinical excellence and basic science concepts in a way that makes sense to them, and the teaching will be consistent as they move from clerkship to clerkship. For students who take the full clinical excellence course, such as palliative care, the integrations provide additional opportunities to apply that learning. And for students who do not take or haven't yet taken the clinical excellence course, they will still gain some exposure to these critical, but sometimes overlooked topics. And all this is done in a way that should add very little time to each case. The combination of clinical excellence case sets and the embedded curricular threads can be used throughout a student's educational career. For example, in preclinical years, programs could use the clinical excellence case sets to introduce students to topics that will be relevant throughout their clinical training and give them some exposure to clinical scenarios through the application cases. During clinical rotations, students will have opportunities to recall and reinforce that learning through the integrations as they take cases on core clinical rotations. And as they transition to graduate medical education or take electives or capstone course, they can dive deeper into clinical excellence topics or group signature cases with similar integrations to enhance their learning. Finally, let's talk about Aquifer integrated illness scripts. Aquifer published our first integrated illness scripts in 2021, and we've continued to add to the available scripts over the past 2 years. Each script covers one specific condition and includes a brief discussion of the epidemiology, the key clinical features associated with the condition, and the core scientific concepts associated with that clinical feature, plus pages that allow students to think about the implications for further workup and management of each condition. Each integrated illness script also includes a mechanism of disease map. These maps illustrate the relationship between the key features of a condition and the associated basic science concepts. In the mechanism of disease map for asthma shown here, students can see the basic steps involved from an environmental trigger to clinical presentation as cough or dyspnea, for example. There are 33 integrated illness scripts currently available, with 8 more on the way this year on the conditions listed here. You can find a full list of available integrated illness scripts on Aquifer's website. We hear from students that they get the best experience from Aquifer when cases are linked to other learning, either related to a patient in clinic, filling a gap in their experience, or as part of a group or class learning activity. And we hear from faculty and preceptors that they are short on time and often can't recommend content for individual students. This year, we will give students the ability to direct their own learning by providing access to the updated content library. Students will have access to a simplified version of the content library that faculty can already access from their Aquifer account, providing students search and filter options to help them find the cases they need to prepare for clinic, brush up on key conditions, and fill gaps in their knowledge and experience. Students will not see the final diagnosis for each case, but they will be able to search by patient demographics, clinical location, body system, condition, and discipline. They will also be able to create a to-do list from their content library to save cases to complete later and to organize their work. We encourage you to keep this in mind when creating case assignments. For example, if your program assigns a lot of cases in bulk, you may want to consider assigning a smaller number of core cases and allowing students to select the cases that fit their needs or interests. Paired with Calibrate, this feature empowers students to direct their own learning using Aquifer's trusted content. Now I'll turn it over to my colleague, Leah Romano.
Hello, I'm Leah Romano at Aquifer, and I'd like to show you a little bit more of what comes with your subscription. What I'd like to show now is that with an Aquifer institutional subscription, you will have access to the Aqueduct system. And the dashboard that includes the tools and content that comes with your subscription will appear on a page that looks similar to this. Each account is for separately accredited programs, and you can roster all users to that account. Let's show you the users page. All users must first be rostered into the account to have access to content and tools, and you can separate the users by administrators and staff, as well as students. So the tab that I'm showing right now is administrators, and you can see that there are different roles with different permission levels that you can assign your faculty and staff. You can also add students, and they have their own tab, and it's for all your students from first year to final year. So that means you can include your didactic level, your clinical level, as we have content for your entire curriculum. There are buttons on the far right and instructions to help guide you through it. Let me show you the content library, which shows access to all of the content that you can search through drop-down menus and a keyword search. This allows you to familiarize yourself with the content, and it's also the first place to start when you want to create a custom course, a unique function in our system that allows you to mix and match content from your subscription to make streamlined assignments and reporting. So take a look here on the top. We do have a variety of drop-down menus to allow you to search to find content for your curriculum, from presenting problem, final, and additional diagnoses to clinical focus, disciplines and location, as well as age groups and system. You can also start with the titles of the subscription courses that you purchase. either Aquifer signature courses, such as family medicine, pediatrics, neurology, and more, or basic science disciplines, our integrated illness scripts. Whichever way you search, the content will winnow down from the large total that you purchase into what you're looking for. So let's pick something. Let's say we're focusing on women's health. I've used the clinical discipline dropdown, and the more than 200 cases has winnowed down to 26 matching items. From there, I can just look at the titles of the content that you can see is across many of our courses. I can also use the links on the far right and click on synopsis, learning objectives, and case summary to take a look at more detail. You can click on the title of the case to see more and dive in, or you can start making assignments from here and create a custom course. We have additional tools on how to create a custom course, but it starts from here, from using the drop-down menus or the keyword search and pressing the Create Course button on the right. In addition to our content and tools, we have resources that are available to help you sort so you don't have to reinvent the wheel. So our Educator to Educator resources directory is listed here with webinars, blogs, and podcasts created by your peers to help make your job easier. There are hot topics that are sorted here for your benefit to take a look at. You can access it through the system, and it takes you to this page to look more. So we can see here there are a variety of headers. So for example, didactics. If you want to assign an FM course while you are discussing a physical exam, that's an option that you can use a custom course or take a look at a tool here for that. If you'd like to assign an integrated illness script with a case and find the connections, that's another example. And you can also use our interdisciplinary content and fold it into your assignments. Those are some examples that are listed here. For our core clinical content, we've got activities, we've got suggestions on how to meet accreditation, we've got tips on our assessment tools, student perspectives, and a lot more that you can prepare. If you're trying to remediate your student, we've got some suggestions for that too, for targeted skills and topics that you may want the student to review. And then also we've got elective planning. So if you've got core content that you'd like the student to take a look at, we've got some of the suggestions there too. We also have a section dedicated for getting started and training tips for you too. We encourage you to take a look. Let's review your institutional subscription options here at Aquifer. We're going to start with the Curricular Partner Program, our most popular subscription option and the best value. You can see what's included is enhanced benefits, including our full library of more than 200 cases, including what's new in 23-24, such as neurology, clinical excellence case sets, embedded curricular threads, and Aquifer Calibrate, our formative assessment. There's a lot more that comes with a Curricular Partner Program too, such as curricular planning and consultations, expert support and online resources, teaching tools and faculty development, and our unique Aqueduct teaching and learning platform. For more targeted needs, you can select the limited subscription option as well. A lot of great tools come with that too. What makes Aquifer unique is that we're a proud nonprofit. We focus on clinical reasoning, and we build better clinicians through virtual case engagements. We're here to help. Now let's go on to our Q&A.
Hello, everyone. Thank you so much for your time, your talents, and your expertise, Dr. Stewart, Leah, and Amos. As we transition to our Q&A here, and we begin to talk a little bit more in depth about some of the impressive new features and courses, cases, tool sets, et cetera, that are coming in the 2022-23 subscription year. I just want to take a second and reintroduce you to the Aquifer panelists that we have here today. First, we have Dr. Emily Stewart, our Chief Curriculum Officer, Ms. Leah Romano, our Relationship Manager, and Ms. Kate Hancock, who's also a Relationship Manager. I encourage any of you who are still attending the webinar at this time to please place any additional questions that you may have in either the chat or the Q&A panel as we're having this conversation. We want to make sure that we are able to answer any of the questions that you have and to get you in touch with the right experts to support your journey as an Aquifer subscriber. One of the most exciting new features that we've heard a lot of talk about and that a lot of our customers have reached out to us about is the Aquifer Calibrate, the new formative assessment tool. Dr. Stewart, for those programs who are interested in implementing this assessment into their curriculum, do you have any specific use cases or best practice advice on how they can get started and the best way that they can begin to incorporate this assessment into their curriculum?
Thanks, Tracy. I'm more than happy to speak on that. I think that the beauty of Calibrate is that it is formative for the student, which means that there is opportunity for you to implement it at many different scales while you figure out exactly how it fits best in your system. Ideally, you would have the students do an early assessment week 1, week 2 of a rotation. If it's a longitudinal curriculum, as I know Kate has fielded some questions on, again, that first month or 2, perhaps that they're getting going in their 3rd year. And then as they have more experience on their clerkship, they can take the feedback they received from those reports to target their education further. Maybe they're outstanding and received, really positive feedback on specific cases like, I don't know, let's say chest pain. So then they need to go out on the floors and they need to see more patients with chest pain so that they can continue to reinforce that knowledge that they're already doing so well on. But perhaps they're really struggling in another area and they received feedback from the Calibrate assessment that they needed to improve their knowledge and their clinical reasoning around another topic. I don't know what we could pick, a multitude of things, let's say abdominal pain. Well, that means that they need to do more cases on abdominal pain in Aquifer to prepare them to go out to the floors and to be able to take care of patients with abdominal pain. And then after those few weeks that they've had an opportunity to work through the floors, work through their cases in Aquifer, they can take their late assessment. And at the late assessment, they can look and see how they are doing in the areas that were weak before that are stronger now, or vice versa. The ideal in all of this with Calibrate would be for them to develop an individualized learning plan that they share and work with a coach on. Each school's at a different place with their coaching, but any opportunity for the student to take the formative feedback they receive from their Calibrate assessment and sit down with a learning coach and talk about what the next step are is a great opportunity for that learner.
Great. Thank you so much, Dr. Stewart. Another question that we've received is around the custom course feature. And I think, Leah, you provided some additional information and guidance around those custom courses. Do you, as relationship managers who constantly work with our customers in a one-on-one basis, do you have any specific examples that you can share on how current customers have used custom courses within their curriculum in a very powerful or positive way?
Certainly, and I can start, and if Kate has additional comments from the customer she speaks with, I'd love for her to share. There are a variety of ways that you can use the custom course feature. Some programs, this is a useful tool for them to separate a particular class or cohort. So it's looking at managing a group of students with the content they want them to see. Another scenario is when programs want to make a certain class or certain faculty member, it's their responsibility. I am teaching X. I want that streamlined report and the streamlined assignments so that I can view it based on my user role. That's another scenario. It's per class, and you can title it whatever matches your classes, so it matches the assignments on your end. But then there are some other ways which we introduced in the presentation, which is really looking at how you can integrate the content into what you're teaching. So maybe there are some assignments that you want to take a look at, like family medicine or neurology or women's health, that you just want to look at the course and bundle it so you can see the reporting. But you may also want to integrate and mix and match the interdisciplinary content, such as diagnostic excellence or trauma-informed care, or using the basic science integrated illness scripts. And you might want to make that connection by saying, okay, family case X, I want to also be talking about the basic science that goes with it. So those are some scenarios that are very helpful. But it's looking at the content. It's also looking at what your students want to see. And also it's a great tool for looking at the reporting end as well. So you have a streamlined report, and there are a variety of ways to use it. We're here to show you how.
Tracy, the only thing I would add is that you know, Aquifer really represents enormous depth and breadth. And what you can do, and I think as I've seen probably the most powerful use of Aquifer is at a large Midwestern medical school that has actually many different tracks for the ways the students move through the program. So you have kind of a traditional clerkship structure. And then there are, at the same institution, students may elect through, actually, I think a competitive process to have an LIC in their traditional clerkship year. So in this one institution, you have the traditional clerkships, you know, assign their students or tell their students to do X, Y, and Z within Aquifer Pediatrics. And then alongside that traditional clerkship, you have LICs created. And they pull upon the same exact content, but it's packaged in a way that suits that particular pathway through that medical school. So it's really a wonderful illustration of an institution taking what Aquifer offers and tailoring it through the custom course to what it needs and what its students needs. I think it's incredibly powerful. It also allows programs that, for instance, assign maybe 20 of our FM cases in the traditional clerkship year, and then in the fourth year have a sub-I that takes advantage of the remaining cases, because those students know they're going to become family physicians. So there's enormous flexibility, and it really allows a program to take what Aquifer offers and make it its own.
Tracy, I actually had one other suggestion, if that's
Sure,
all right.
absolutely.
It was Kate made me think of it, and it was noted in the presentation under remediation. So a lot of programs, they use the custom course feature to remediate their students and design what they'd like that student to cover again.
Yeah, I mean, and I think, again, that's a really great example of just the breadth and depth of how you can use, you know, Aquifer content and courses throughout the curriculum. And, you know, that kind of sparks another question that comes up a lot. I know in our area, Leah and Kate, and I promise, Dr. Stewart, I'll get back to you. I've got another question for you. You know, a lot of times, you know, when people consider an Aquifer subscription, or they have their subscription, they think very heavily of us during the clinical years and the clinical experiences. But really, we can, as you pointed out, Leah, you can register your students and sign up students throughout the whole time that they are going through their medical journey, from year one all the way through to being used for the core clinical experiences and the electives, and, you know, even beyond that. You know, can you help just kind of clarify that and provide any kind of experiences you have where customers are using Aquifer courses and content throughout the clinical experience, and I'm sorry, throughout the curriculum experience?
Sure. So some of the ones that I have heard that match all the needs that could define all types of users. The most common are programs that want to match an assignment, and they want to make it very clear within the system. So whether that's mixing and matching, following a certain structure, remediation, etc. That's definitely one way. And whether it's clinical or didactic, focusing on the content that you purchase or what comes with your subscription and making use of it, really integrating it. Another is there are programs that want the students to look around. So you can, once you add your students to the system, they have access to the content. So there might be optional assignments or things that you want them to find if they have an interest. So that is a possibility too. There's also mapping to and connecting to a particular assignment. If you're going to see this type of patient, maybe you're asking the student to prepare for that scenario, or maybe you're using it as a follow-up after you saw the student, or in lieu of. That we all know there are certain situations where you may not get to see that type of patient that we have embedded in our curriculum that you may want to assign. So those are some types of scenarios of how to use it. I've also heard from some programs who are getting used to either our new content or our content, that they assign cases to their students so they can get familiar with what Aquifer is. So in those first years, they're like, you know what, you're going to do 5 cases and you're going to get familiar with it and you're going to learn to love it. So to help with the fire hose. So those are some scenarios, but I'm curious what Kate has to say too.
I think the thing that I would add is that, and Amos referenced it, that we launched the integrated illness scripts in 2021, which really was not the ideal time because of the lovely pandemic. Folks are now really beginning to explore the integrated illness scripts much more and learning how they can integrate those scripts within their basic sciences courses. And people are very creative in those areas. And they are discovering within our educator resources section the fact that we have 2 really excellent integrated illness scripts learning sessions there, utilizing the integrated illness scripts. And those are ideal. Scripts are designed for any point within a healthcare education, but the scripts really could be incredibly powerful within the didactic part of your curriculum. And having students, we actually have kind of starter kits. These integrated learning sessions are starter kits for programs. People do not have to, as Leah said, reinvent the wheel. We have a starting point for folks, a model right there. And I think the scripts are really an untapped source of learning within the Aquifer system.
Great. Thank you so much, Leah and Kate. No, another thing that I found very interesting was when Amos was talking about the just-in-time learning threads, the clinical excellence topics, and even some of the basic sciences that you were talking about, Kate, and that they're kind of being woven into those clinical cases. And that students at some programs that are using Aquifer and are using them across multiple courses are kind of benefiting from a more consistent experience or a consistent teaching experience on those critical topics. Dr. Stewart, can you talk a little bit more about that and some of the intention behind some of these more integrated pieces that are coming this year?
Sure, absolutely. I think all the educators that are listening to us today recognize that it's not uncommon for us to teach content in specific areas in our curriculum and not ensure that it is then longitudinal as students work their way through their clinical years. We know that they are seeing more than just clinical medicine. They are seeing social determinants of health. They are seeing trauma-informed care cases. But for us to ensure that they're actively being taught in the process of seeing the patient is where the clinical and the basic science integrations come back into this. And so this idea of making sure that they have solid principle and application cases on these topics through the newly formed clinical excellence course, further integrated into their day-to-day exposure in their patients and their assigned Aquifer cases to go with those patients, is making sure that repetition is happening, because we know that repeated exposure to content is what ensures that our learners are learning. Getting back to formative learning process, master adaptive learners, all of these concepts going across our curriculum, making sure that our students are seeing it just in time for their learning so that it is relevant in that moment, which means they're going to retain the information much more.
Great. Thank you so much for that insight. Well, as we're wrapping up here, I thought it might be, there's so much great new content that is coming out this year and so many new tools and resources that are going to be available for those who are utilizing Aquifer subscriptions. I'm just wondering, and I'm curious, I'm sure it's hard to pick just one, but if each of the members of our panel would like to share what you're most excited about and what's coming up that really makes you excited to be able to bring to our subscribers as they continue to try and navigate the changes and the constant evolution of the medical education curriculum.
Well, I will.
You, Kate.
I will go first. I was not going to
let
not let me go first. I am over the moon about Aquifer Neurology. Those of us who've been involved with Aquifer for years have known that folks have been chomping at the bit for neurology, and we have made it happen. It is coming, and we're incredibly excited about that. And for many years, a lot of programs took advantage of cases from geriatrics, for instance, to expose their students to neurological content. But these are cases developed by neurologists, and will completely expand offerings within the vast range of healthcare education programs that are out there. And I'm incredibly excited. There are also shorter cases, so it shows that Aquifer has been listening to our subscribers who are interested in having more shorter cases for their students, because that's what students want. And I think so I think we're really hitting the mark on a number of really important things with Aquifer Neurology, and I am so excited about this course.
Great, thanks, Kate. Leah, we'll go to you next.
Sure thing. It's a combination of things, actually. So I love seeing the clinical excellence case sets and how they've been bundled and how they're going to be available to you to either use on your own, enhance your curricular planning, or mix and match into the courses that already exist. But it's a strong tie with the tools that we've created. We have enhanced educator guides, as well as webinars, web shops, blogs, and podcasts that your peers on our academic consortium, as well as our health professions education content and teams, our DO, PA, NP task forces, have created a variety of tools that you can implement into your program teaching. And so it is that tie between those two, and I hope you use them, and I really can't wait to hear feedback on what you think of them.
Great. And Dr. Stewart.
I think I'm next. So for me, I'm excited about all of it, but I think I always get the most excited about things that are new and different, and perhaps are pushing the edge a little bit. And I consider Calibrate to be doing that. The Master Adaptive Learner Framework came out from the AMA a couple of years ago now, but to actually see us pushing forward with a formative assessment process that is ideally making all of our learners Master Adaptive Learners is what I am most excited about. We, as you know, I think I said a little bit ago, the DOMD pilot has been completed, and the NPPA pilot is about to be finished, with us going live for everyone in July. And I think that every learner out there can benefit from becoming a better Master Adaptive Learner. And so I'm really excited about Calibrate for that.
Great. And we actually have one additional question that just came in from one of our attendees, and they're asking about who the most appropriate person is to reach out to find out more about Calibrate, that they've been giving the FMED pre-test exams for 3 years. So I think you've got 3 different people on this call who I'm sure can provide some level of knowledge and information to you in regards to that. But I think Kate would probably be the best person to reach out to immediately. And we can follow up with you directly to ensure that that connection gets made. All right. Well, thank you again, Kate, Leah, and Dr. Stewart, for your time and for your incredible insights. Hopefully this has been very helpful to those who have attended. And I just want to take a moment to also thank those of you who have attended our webinar today from across the various health professions. Really appreciate your time and look forward to providing you with any additional insight or information you may need following this webinar, and to continuing to serve you as you continue to educate the next generation of health professions experts. Thank you so much and have a great evening.